This is a Foley catheter kit. We're going to open it and review the items inside so that you'll be familiar with the supplies that it takes to insert a Foley catheter in either a male or a female patient. The tray is sterile, so you open it by pulling on the adhesive side of the package, and then you remove the box from the package and place the packaging to the side. You open the tray by removing the tape on the back or loosening the tape on the back and unfolding your sterile field. Within the tray you have all the items that you need to place a Foley catheter for either a male or female patient. We're going to review the items that it takes. So the first item that you have is a sterile field. There's a shiny side, which is to repel water, and then a non-shiny side. The shiny side will go down when you're placing your sterile field. Additionally, inside the package is your sterile gloves. So you would switch from your non-sterile gloves into this set of gloves. So you remove this from the package, and this is your sterile gloves. The next item that you have inside of the package is actually an additional sterile field, an extender, and it has a triangle in it. This will go over the appropriate anatomy according to your patient. Then you would remove the next part of the tray, which actually has your lubricant and your cleansing agent. There's betadine inside of the package. You also have cotton balls, plastic forceps, a specimen collector, a 10 cc syringe that's filled already with saline to fill your balloon on your catheter, and lubricant jelly for the ease of insertion for patient comfort. Next, you have the actual catheter itself, and it's attached to a drainage collection bag. So on this one, you have a urine meter and the bag, and your catheter is enclosed. This is a sterile sleeve which gets removed. This is the catheter. This is the port where you apply your syringe to fill your balloon. That's the balloon filling. This port is used for sampling, and this is a securement device that you can actually use to secure the catheter to your patient's leg. On the catheter tubing itself, this is a clamp that you can use to secure the catheter tubing to the linen so it doesn't tug and pull on the patient. And you can also use it to clamp the catheter during procedures if you need it not to drain fluid. These are all the items that you would need in order to place a catheter in either a male or female patient. This is a demonstration of the placement of a Foley catheter in a female patient. First, you will need to expose your patient while maintaining their dignity. You open the catheter package by loosening the adhesive end. The packaging will be used later in the insertion to place your soiled or dirty items so that you don't interrupt your sterile field. Untape the back of the package and open it, maintaining a sterile area. You will first remove the initial sterile field and place it shiny side down between your patient's legs. This is made easier by opening the legs in a frog leg position. Next, you will remove your clean gloves and apply sterile gloves. After removing your clean gloves, you will open the sterile packaging and apply sterile gloves. This is done by using the cuff of the sterile glove inside of the package. Now that you have on sterile gloves, the procedure remains a sterile process. The next item that you retrieve from the package is an extender for your sterile field. The diamond is placed over the proper anatomy. Ensuring that your patient is not allergic to betadine, you will use betadine to cleanse the perineal area prior to placing the Foley catheter. This is done by applying the betadine onto the cotton balls in the tray. At this point, you will also open the lubricant. It is in an accordion style bottle, and you will inject the lubricant onto the tray. In the preparation phase, you also attach your 10 cc syringe of normal saline to the Foley catheter. It is not necessary to test your balloon at this phase. You will remove the blue sleeve from the Foley catheter and ensure that your catheter remains on your sterile field. Now it is time to cleanse your patient's perineal area. This is done by opening the labia with your non-dominant hand. Once you've placed this hand, that hand is no longer sterile, and it is important to remember that to maintain sterility. You clean with a top-down motion with betadine and place your dirty betadine cotton ball away from your sterile field to maintain your sterile field. You will repeat this process 3 times, ensuring that the area is thoroughly cleaned. The dirty forceps and dirty cotton balls must remain off of your sterile field. The next step in the process is to lubricate the end of your Foley catheter in the lubricant gel. Coil the catheter around your hand to ensure that you do not drag it in a non-sterile area. Once you visualize the urethra, you will insert the catheter. In a female patient, you will insert 2 inches past visualization of urine in your catheter tube. Once you visualize urine in your tube, your assistant can inflate your balloon by injecting the 10 cc's of saline into the catheter. You then disconnect the 10 cc syringe from the catheter by simply twisting it lightly and removing it. It is dirty now, so it goes away from your sterile field. The catheter will come till it meets resistance, which is the balloon, and then it is important to secure the catheter to your patient's leg so that there will be no tugging or trauma as related to the catheter. This is done by securing the device to the patient's leg on the side that you intend to hang the catheter to bedside drainage. It will stick to your patient's leg, and then you hang the collection bag to gravity at the side of the bed below the level of the bladder. Then remove all of the supplies that you used and discard them in the normal trash. Return your patient to the position of comfort, provide for their dignity, and elevate your side rails before you leave the patient. Placing a catheter in a male patient is very similar to placing one in a female patient. The sterile field is set up the same way. You will first place the penis in your non-dominant hand and cleanse the meatus by using a circular motion with a betadine covered cotton ball. Remember to place the cotton ball away from your sterile field and continue cleaning. This process is repeated 3 times in a circular motion using 3 separate cotton balls. Once you have properly cleanse the meatus, you will lubricate the end of the catheter. Coil the catheter in your hand so that you do not drag it into a non-sterile area, and place the catheter into the urethra. In a male patient, you must insert the catheter all the way to the Y juncture of the catheter, or hub it, prior to inflating your balloon. You instill 10 cc's of normal saline into the balloon and remove the 10 cc syringe from the catheter. At this point, the catheter will retract from the penis until it meets resistance with the balloon. You will then secure the catheter to your patient's leg to reduce the risk of trauma from pulling or tugging of the catheter. The catheters will slide into the Velcro securement, and then you will place your bedside drainage bag below the level of the bladder on the side of the bed to allow for adequate drainage. Once you've completed the process, you will clean up the area discard the items, cover your patient to provide dignity, ensure patient safety by elevating side rails and lowering the bed to the safest position.